More than 2.2 million people in the United States are being denied health care coverage because 12 states refuse to expand their Medicaid programs under the Affordable Care Act.
The Medicaid gap refers to the fact that when the Affordable Care Act, Obamacare, was passed, the federal government moved to expand the number of people who had access to a federal government program or a shared federal-state program called Medicaid. And 38 states did that. They lowered the bar in terms of income for qualification for that program. What happened, though, was that there are 12 states that said, no, we're not going to take the federal dollars. We're not going to expand the program. And those 12 states disproportionately have a higher population of people of color, Black and Latino Americans. What has resulted is that there are over 2 million people in America who would have access to Medicaid if their states would expand the program, who currently do not have access to health insurance.
Dr. Richard Besser is the president and CEO of the Robert Wood Johnson Foundation. That's the nation's largest private health foundation. Dr. Besser is also a pediatrician and the former acting head of the Centers for Disease Control and Prevention under President Obama. If he looks really familiar, it's because he was also a TV news health and medical editor. Dr. Besser says the lack of insurance is terrifying for so many Black Americans.
It means that people are living under fear that if they get sick, they may not be able to get the health care they need. They're living under fear that they may have to make an incredibly hard choice between getting medical care and paying the rent or putting food on the table. They're making incredibly hard decisions about getting screened for cancer, getting screened for high blood pressure or diabetes. What we've seen in the states that have expanded Medicaid is an improvement in people's quality of life, improvement in their health outcomes, improvement in state economies. This is an easy one. Expanding Medicaid in these states would have a profound effect on people's lives.
Dr. Besser says the decision of these 12 states to turn down the federal dollar has had a particularly profound impact during the pandemic.
As we've seen here during the COVID pandemic, you've seen this crisis hit all communities, but not hit all communities the same. We've seen Black and Latino and Native American communities get hit the hardest by COVID. These are some of the same communities that are being hit the hardest by failure to expand Medicaid.
Dr. Besser says the answer lies on Capitol Hill.
For so long, the focus has been, if you could just provide more evidence to states, they'll do the right thing. They'll see that it's in their economic interests to do this. But this has become such a political hot potato that some states have just said, well, because this was something passed by one party, we're not going to move forward on it. Congress can take action. There's a lot of different ways that Congress can move to close the Medicaid gap. They could pick up the full cost of that. They could look at other types of incentives. And so, we're not saying how they should do it, but we're saying they need to do it because lives are at stake here and the states have not done what they need to do.
Dr. Besser says the lack of coverage is particularly harmful to the Black and brown communities, which are more likely to work in jobs that do not provide health insurance.
We are the wealthiest nation in the world, and we're the only wealthy nation that doesn't ensure that everyone has high quality, affordable health care.
The lack of coverage costs money because easily treatable diseases like diabetes and high blood pressure are often not taken care of until it's an emergency and the person lands in the hospital. That means bigger bills, sicker patients, and too often lost lives. For BNC, I'm Nasha Sherman.